So ladies, we're going to go ahead and get started. Just a little bit of housekeeping before we start. We're going to mute our microphones just so we don't have that feedback from the microphones where it starts squealing. In the lower right-hand corner is your chat box. If you have any questions for Julia, if you can write into the chat box, we'll go over the questions throughout the presentation. We're also going to have an evaluation at the end of the presentation. And just a reminder, this is going to be recorded, so we will start the recording once Julia starts her presentation. So, but we do have a new face. So if, Kristen, if you can introduce yourself to everyone. Can she hear me?
Yeah, hello. Hi. I'm Kristen. I work with Matheson Memorial Health Clinic. I am new in the position as the grants coordinator / many other things they asked me to do. So did you want me to talk about what we're doing or just who I am?
Well, just who you are. I think eventually at our ACORNS resource meeting, you guys are going to all get to know each other.
Okay. So yeah, that's me.
And so I would like to introduce Miss Julia Russ. She is from Round Valley. So she's going to do a presentation on her project and where she's at currently. And then if you have any questions, again, for Julia, if you can put those in the chat box, and then we will start that discussion.
Okay. Okay, thank you. So, am I doing this right? Okay. Whoops, start from the top. Sorry.
And then down at the bottom, yes.
Okay. All right, so good morning, everyone. I'm happy to share with you today. I work for our health center here in Round Valley, and I am ACORN
presentation so that we can see full screen.
Sure. I am the ACORNS coordinator. Can you see it now? Okay. So when I left for the meeting the other day, I thought that we had named our project, but there were some ballots when I got back, which was kind of cool because we wanted to have a lot of input on what we're going to name our project this year. And so the new ballots push it over to a new name, which is Food is Life. And so we're trying to name our project and sort of brand it so that wherever you see our produce growing, our gardens, our raised boxes, you'll see our Food is Life sign, and know that we're all of the people that work on the project are involved, and we're all supporting the project. So this year we decided to do healthy eating. We have a lot of diabetes, incidence of diabetes and other health problems related to diabetes in our community. So we were focusing on commercial tobacco and sort of doing rethink your drink, healthy foods and drinks changes. But this year we thought, no, we need to really focus on healthy eating. So one thing about our community is we are a food desert, and the USDA has a definition of that, and it's locations without easy access to fresh, healthy, and affordable foods, and that is Round Valley. We have one supermarket, and it is a medium-sized USA chain, and they have most of the produce comes in from, it's commercial produce. And so we have no other options. We have a small farmers market. We're sort of working with them to see if they can start using like EBT or CalFresh so people can buy fresh produce there. But other than that, we have to depend on what we grow. And also at our market, we have a hot food case. And because there's really nowhere to eat out here in the evenings, people eat out of the hot food case. So one of our goals is to educate people about how unhealthy it is to eat out of that. We kind of awfulize it. So if we see each other there and we're getting something out of the hot food case, we'll give each other a hard time. But really, we're really encouraging people to eat more healthy with this project. So connecting healthy eating to healthy living. To do that, we are launching Cooking for Health. It's something that we've done in the past with our CITE, which is our diabetes education program. But our classes are to provide time to talk about healthy ingredients. Having a healthy gut contributes to healthy body, mind, and spirit. And our plan is really simple. We're going to be teaching about eating healthy foods and growing healthy foods to eat. And that's our project, basically, in a nutshell this year. We had this really awesome presentation by professor from Humboldt State. I don't know if he's still teaching there, but Dr. Michael Yellowbird, and he talked about decolonization of the mind, and how really what you eat and how you sustain yourself really contributes to your total well-being. And all of his research about neurodecolonization is really the basis of what we're trying to promote by, the Garden Project this year. One of our partners is Indian Health Service, and they are going to be doing food safety in the kitchen and classroom before we start. We're hoping to get, these are some of the topics we're going to cover, like being clean, separating raw and ready-to-eat foods, keeping cold foods cold, and keeping hot foods hot. But basically they come and do a one-day classroom style session, and everyone gets a food handler certification. We're also going to be partnering with Mendocino College because they have a longer version of that class where they go into a lot more depth. And so we're trying to get that class here for the summer. And if we can get someone to teach it, then it's going to happen. And so our group really wants to have that class here because we have a lot of people who do serve or sell food out of their homes. We have people who make burritos in the morning, go around and sell them, and people who sit in town with a little table and sell Indian tacos and, different foods that, because there's not a lot of places, not a lot of choices to eat out. And so we're hoping that group of people in, also people for all our booths at Indian Days, all of those vendors who come back every year, invite them to come and participate and be part of that project. So this is the other thing that Indian Health Service is gonna help us with. And also, I'll talk about a little bit later, but one of our other partners is the UC Extension Project, and we're going to have one of our workshops really talk about handling fresh produce. And so that's part of our food education series. Hotspots, our raised garden beds is a project that we're implementing to expand our garden. Our community garden is located behind our behavioral health services, and it's a really nice place, and it's beautiful. We've been using it for several years. It's not very accessible to elders on the weekends, to families. So to make the vegetables more accessible to different populations, we're going to have 4 hotspots. So one's going to be at our elders complex, which is where 17 of our elders live in a cul-de-sac, and they're duplexes. And so at the end of their area where they live, at the end of the cul-de-sac, there's this perfect spot to put some raised garden beds. So we're going to have them there. We're also going to have them at our senior nutrition center. And the senior nutrition center is right next to our tribal administration building. And we've been having a lot of elders talk about the fact that there's a lot of secondhand smoke because the staff there is using a little covered area for their smoking area, and they really want us to help make that a non-smoking zone. So we're trying to have we're trying to do 2 things. We're going to have our hot spots there with our vegetables and the boxes, and then we're going to encourage people to smoke elsewhere. So our health center is completely smoke-free, but the tribal offices aren't. So that's kind of our maybe next year project, that we will start talking to our tribal programs about having smoke-free areas and smoke-free zones. But this year, just to encourage that senior nutrition center area to be smoke-free, we're going to locate the boxes. So we're hoping that people don't still smoke out there and just put their cigarettes out. So it'll be something that, you know, we sort of keep track of and talk to people about. And also our youth program over at the housing, we have Building Horizons, and they're going to participate. We're going to have some in-ground planting there. They have some area and a couple of raised boxes. And then here at the Wellness Center, we'll have, we have some youth that are part of the FFA group, Future Farmers of America, who want to come to the Wellness Center and help with those boxes and tend them. So it's kind of exciting that we're expanding. And then, of course, we're going to have our community garden. Another partner is Yuki Trails, our behavioral health department. We're working on a wellness contract. So people who are participating in their recovery program, either they're going to court-ordered classes or they're doing self-help, when they work with their therapist or their AOD counselor, and one of the options will be that they can have a spot out in the garden and to grow some vegetables, whatever they would like to grow. And so if that's something that they choose, then they'd enter into this wellness contract. And so some of the things that we've learned just from our own community is that gardening is therapy. And we know that because people from the recovery program have participated in the past, and it's been really helpful for them to be out in the garden and to see, you know, their plants bearing fruit and vegetables. And so we really are excited about this formal wellness contract. Even though we've done it in the past, we want to see how this works because we want to share that. We want to share it out that, you know, this many people participated and they really got over, you know, that big barrier in their wellness and their recovery, and this helped them. So hopefully that's going to be something that we can share out. So it just says mental health. It increases mental health wellness, physical health wellness, and for substance misuse, it's therapeutic with the manual work and, you know, being out in the garden. So we have a new partner. Just by chance, we found out about the UC Cooperative Extension. They had a master gardener. We were looking at something, we found this master gardener certification, and of course it was too late to get us someone from our community in there. But we found out there were 4 people from Round Valley that were in the class, the Master Gardener certification class. It was being held over on the coast in Fort Bragg, and then they had a couple of classes in Gualala. So those 4 people are from this community, not the native community, but Round Valley, and so they have 50 hours to complete as part of their certification. Kind of a what is it called? So, well, their internship. So they're going to be assigned to our garden. So we get free master gardeners, 200 hours. And so we're excited. They already started doing some of the topsoil work over there. And they have mad gardening skills. Like, they are people who have already gardened for many years. They've just gotten their certification and are just really excited and, you know, ready to go out and work and help us. So we're so happy about that. And then we have some interesting gardening workshops that we're going to do. So we decided that, since with the cold weather extending this year, that we're going to start at the end of April. We're going to do Gardening 101. So anyone who wants to have, we already have some people sign up, but families and organizations that want to have garden spots, we're going to have them come to Gardening 101, and we're going to talk about planting and just caring for plants and, you know, growing seasons and all kinds of stuff. So the other thing we're going to do is composting. Those are the 2 that we've already decided on. And the end of the season harvest, we're going to do canning. So there's a couple other in there, some others in there that we haven't decided on yet. The group's still working on. So, but it's really exciting that we have these people that are willing to come and work with us. So this I put in because like I said, we've done some things around mental health improvement, physical health improvement. One of our therapists that works at Yuki Trails, his name is Dr. Frank Tuttle. He shared that he had some of his clients actually go out in the garden while they were talking and during therapy sessions. And at first they were like, I don't want to do this. I don't know why we're doing this. And by the end of whatever their sessions were, and they started seeing their plants thriving, that it was really inspiring for them. And so something that our tribal community team truly believes that it is very supportive for mental health and getting people active. We're really trying to get our elders involved. What we find in Round Valley is that we have a lot of elders that are, they're shut into their home. They don't feel included. So we're trying to think up ways that we can have them be included too. We talked about doing like little boxes for them in their front yards. It's totally doable. It's something that we're still kind of throwing around. Came up at our meeting actually just this week. So that's something that we would like to do for elders. We really want to give back to our elders. And we know that throughout the years, many of our families had backyard gardens, and for some reason they just haven't continued, maybe because of aging, or their children weren't interested in doing it, or maybe just not excuse me, enough room to have a garden. Like over at the elderly complex, we're going to have the raised boxes. Their backyards are really small. Their soil's really gravelly, so there's some barriers. So to get elders involved, we really want to have a small project for them to, if they agree and if they want to do it, and if their family would lend some support. So I think that's all I have. Yeah. Whoops, sorry. So that's our project this year. I don't know if anyone has any questions, but we're excited and we think that it's going to be really helpful for our community. I think that it's going to involve more people, because before, when we were doing tobacco, the tobacco project was more about what not to do. We don't want you smoking here, kind of exclusive. This is really inclusive, and it feels really different. It feels really good that we're going to have all of these partners and all of these people that are going to benefit. And then when our big community garden does produce a lot of vegetables, so we share out. We're going to have a couple spots where we just set vegetables out, help yourself kind of. So it's exciting. That's all I have.
That's awesome. Thanks for sharing.
You're welcome.
Some discussion questions.
So I wanted to maybe kind of put out some questions, and I know Rebecca and Kristen, you guys are both kind of working on clinical community linkages a little bit more and diabetes prevention programs, but I did want to kind of just ask, Julie, you've done a really good job at like developing these partnerships, and it's really interesting to see how much they're actually really contributing to that project. I mean, so many different partners. You listed off like 4 or 5 of them that are pretty heavily involved. And I wanted to maybe just ask for, for even with DPP programs, diabetes prevention programs, oftentimes that happens in the clinic, but are there ways to incorporate other partners maybe from the outside, or what was that process like? And maybe just kind of a group brainstorm as to how you think partnerships might play a role in those projects, or what some potential partners might be. Rebecca and Kristen, you guys might have some more similar ideas since you guys are both doing similar projects. But yeah, I just wanted to throw that out. Question about partnerships, potential partnerships, developing those partnerships, and what that might look like for your projects.
Well, our main, I should have mentioned, but our partner project is CDAC, so Community Diabetes Action Council. We meet together now. So we have ACORNS first, any ACORNS business, and some people only come to ACORNS. And then and then they might leave, but then CDAC, we start our CDAC section of the meeting, and at the end of that is our diabetes education. So that's our main partner. And we know that that we have a high incident of diabetes, and that we have people that are traveling every day to dialysis. And so we're really, this project is about prevention, and CDAC is more about education. So, I mean, they're kind of the same in some ways, but really we're prevention and action. And then they do, people who have been diagnosed with diabetes, kind of how to manage it, what's happening with your blood sugars, why your organs and eyes and extremities get damaged from sugar barbs, and, that kind of stuff. So that's our main partner project is CDAC. So we're all about diabetes prevention. I'm not sure about.
Yeah, nice. Do you, Kristen and Rebecca, do you guys have diabetes action councils through your clinics?
Well, within our clinic, I would say our providers are the biggest partners I have to work with. My team consists of me, so we're really, really busy and stretched. Everybody's roles are stretched pretty far around here. So just to get some time with them, I've been developing with my manager to try to section out monthly meetings for us to get together so I can get ideas and information from them, because they're the ones that are going to be referring these patients to me. So I want to know what they want from me and the needs that they want for their patients, so I can best, develop that. And with that, I can then find partners that will, make that successful. So currently I am working with our local food bank. I met with them yesterday to watch their distribution of what they do, because they pass out once a month. They do this large open distribution, and it's almost like stations where everybody can pick and choose what they want. And I wanted to see what kind of vegetables and commodities that they're given, so I can work with that in my group and show them how they can best utilize these for nutrition purposes. So we're very, very beginning stages of all of this. So my partnerships is slowly building. I know that I have some ideas that I would like to, implement sooner rather than later, but right now it's still pretty in the developmental stages of everything. So, but basically the providers are in-house, my biggest people to work with. Does that answer your question?
Yeah.
I digressed a little bit, but.
No, I mean, I think it's good to kind of share out these different things and kind of share out your different processes and where people are at, because, everybody's kind of gone through these different phases at some point or in some way, shape or form. And so, yeah, I think it's helpful.
We're so small. Our town is so small, and we have one corner store that has maybe a 3-foot section of vegetables, and it's all very limited. So it's almost like first come, first serve for them. And a lot of our patients I saw at the food bank. And so I was trying to keep tally of how many of our patients actually get and use these commodities. So it was impressive to see the amount and the options that they received, as well as how many of our patients were participating. So that's wonderful that it's there, because we just don't have, I guess it's considered a desert. A food desert. Yeah, so that's wonderful.
Yeah. So I guess to kind of ask about a diabetes action council, and maybe for those, like for you, Julia, and I don't know about Darlene, I see that you've joined us, and happy to see you here. And Rebecca, I think that you guys have a diabetes action council, but how did that end up getting started, and who kind of took charge of that? And is that a potential for something you, Kristen, to kind of develop through, like with some providers, but maybe also with community members, or if there's any other kind of health wellness related organizations in your community that would be interested in kind of talking through like how to approach health and wellness or diabetes or, that kind of thing? So maybe Rebecca and Julia, I don't know how those things came about for you.
Can you guys hear me?
Yes.
Yeah.
Okay, so we don't necessarily have like an actual diabetes like council group. Like we have, it's just our outreach department. So our diabetes coordinator and outreach coordinator is all the same, just same like Kristen. We're a small community. So our group consists of our outreach departments, our CHRs, and since we lost our main providers down in medical, now we have to kind of regroup with that because we were doing daily huddles. We were doing weekly meetings with our administrator, but since we have so much other stuff going on, it's just kind of just us. So our CHRs, myself, which I'm a diabetes program assistant since Kristen is new, and then our outreach nurse. And so all of our ideas, we just bounce off each other. And we were working with our provider. They were referring whenever anyone in medical comes in to get A1Cs, labs, or anything, if anyone has a high A1C within the prediabetes or even diabetes range, since we do a support group, then they refer them. So they let us know automatically. They refer them to us. We add them to our eye care panels. We give them calls. We kind of hound them a little bit. So we try to be since we are small, as case management as possible. So since we have a small diabetes group compared to other facilities, they have about 85 patients with diabetes. We do a lot of case management, and especially with prediabetes, since it's something that we've been working on for the past 2 years, but it's something that's kind of slowly getting on the radar now within like the state and within, federal. It's kind of a slow moving process. But we're really big on prediabetes. We do our prevention class, which is, we are in our second phase. And so kind of just do as many community screenings as we can. We don't have so many outside partners. We don't work as much with our travel counselor or anything, but we do kind of just work within ourselves and kind of figure out how to get these people in, how to get them screened, how to get programs running where they'll actually come and where we'll hit the age group where people are actually going to come in and join these groups, kind of get them motivated to have lifestyle changes and that kind of thing. So I don't know if that answers your question either, but
Yeah, no, I think just good to kind of like hear about everybody's different process and kind of who's on their team and what's going on. Do you think that it would be possible or helpful to, have community members be a part of that? Like I was hearing Julia kind of talk about her even just labeling the name of her project, like having a survey and a poll that goes out, like to get that buy-in and that support and kind of that investment. I don't know how consistent your groups are or how consistent your clients or patients are that are attending things or how often you interact with them, but incorporating them into some of those like, action planning or, what do you want from these classes or what are ways that we can get more people or, different things like that or like, what do you want to learn or.
Yeah, it's hard to get community buy-in up here, especially for diabetes. A lot of people don't really want to talk about it still. They don't really want to address the fact that they have diabetes or that they have pre-diabetes, so it's kind of hard to get them to buy in. And we've been trying to do a lot more community education on not even just like diabetes and pre-diabetes, but just everything, breast cancer, cervical cancer, everything that we can kind of get them educated about, because people are so, like in our community, are so hush-hush. Like if someone has some, they don't want to say something, they just kind of want to kind of ignore it. And even with patients that we have newly diagnosed, they just don't really want to address the fact that they have diabetes. That's why we started a new support group. So we're trying to get the word out and at our support group. Like Kristen, we only have one store. We only have Safeway. So what we are doing is to try to get people to come is we're buying fruits and vegetables in bulk. So the people that come, that participate, can take home, fruits and vegetables, because a lot of them get commodities or they're on a budget, so if they can have access to fresh produce, then maybe they'll start realizing, the word will get out there that we are doing this. So just, I don't know.
Julie, do you have any sort of advice about what your process has been like of using your Diabetes Action Council and getting buy-in from the community for your different projects?
Well, our CDAC is in the 3rd year. So when we first started, we actually got support from the Northern Valley Indian Health. So they had already had the CDAC idea and concept, and Grindstone Rancheria kind of took the lead because they had such so many people suffering with diabetes. And so we met Vicki and gosh, I can't remember her last name right now, but you guys know Vicki, right? So we met,
yeah,
and she agreed to come over and sort of guide us through how to create our own CDAC. And Lake County Tribal Health was also participating because we were involved in a research project through UC Davis with Northern Valley. So we were learning about community-based participatory research, which is all about community input. You know, that's what it is. And so when we started doing our CDAC efforts and we brought people in the community together that were either had diabetes, had family members with diabetes, or wanted to, you know, have a healthier lifestyle, we had a big group of people that came, and we did the Res Cafe, and they just shared. We just went around. One person would talk about, you know, what do you see your community being as far as health and wellness, you know? And so we all shared back and just spent a whole day just talking about, do we want to do the CDAC? And so after that, we had a lot of people that were interested, and we had quite, the first year was really active. Now the second year, because I think we didn't have the same kind of support from Northern Valley. We were kind of on our own, and then it was just us. And so then it was a smaller group of people, but we still had maybe 10 people at our meetings. And we still said we're going to follow through with our action plan, because we had created an action plan over the first year. And we did, and we just kept doing our little activities. We kept getting as many people involved as possible. We did our cooking classes. We did our basketball camp to get youth involved. We did, you know, all of the things we said we would do. And in the third year now, we have a lot of people who know about CDAC, so that they come and they want to be involved. And so just persistence, you know, being there, being consistent. If you say you're going to meet, even if it's 2 people. And sometimes it is, you know, sometimes it was just our staff and one other person. So, you know, those times are kind of hard but the thing is, once you get the word out and there's enough people that know about it, then if they know someone's really suffering or really having a hard time dealing with their diabetes, or manage them, or want to know about it, or just got diagnosed, then they'll say, oh, you should go to the CDAC group. And then they'll call and, you know, find out when we're going to meet again. And then they're welcomed in, and we're just really welcoming. Like, please come to our meetings, because it's all about you. It's all about your health. It's not about anybody else's agenda, but just how we can help each other. So. And then we do ours we have a protocol. So we come in and we do, you know, opening blessing, and we do food first, where we have a healthy meal, because we meet kind of in the evening. And we never skip that. So we never skip our protocol. Even if it's just a couple of us, we still open with prayer. We still have our meal, and we still talk, because that gets people, you know, comfortable and ready to share or whatever, listen. You know, sometimes we just do education, but yeah, so consistency and just have an education piece, because that's what people want to know. They want to know what's happening to me, how can I help my family member. And so we always include an education piece, and that sometimes it's the same thing that we did the month before, because somebody had a question about it or something. But we have a dietitian that comes from a hospital in Willits, and she'll come like every quarter, and we get a big following for her sessions. And then we have someone who comes in from Hoopaw, it's a travel member here, but comes and does Tai Chi every other month. So when Perry comes, people, oh, Perry's going to be here, so they'll come and do Tai Chi. And so we have like different activities that kind of draw different crowds, but Henrietta's dietitian groups are really popular. And so we know like what people want to know, how to eat better and how food can help them feel better. And so we do different things. We'll do juicing. We'll try different things with them. That's what. So we're trying this with you too, because we're learning at the same time. So that's how we've done it, and it's been really inclusive, and it feels really good to have people want to come to the cooking classes and look forward to it. And we'll have a different leader each time. So we just try to make it as much as we can, like open to the community. And it's been really, I think we have a really active group. It's not huge, but I think we have an active group. So.
Thanks. So to kind of put that back out to everybody else, and I know Darlene, like you kind of have an interesting situation where your community, and maybe it's similar to some of the health clinics where it's spread out, right? So Cloverdale is a landless tribe, and it's not everybody's living together in one space. And so, or like with Matheson, you might serve a lot of different kind of community areas. So kind of hearing what Julia said, can you think of ways that that you might be able to kind of do something like that, or potential solutions to try to involve your community? And maybe, Darlene, you don't have a diabetes action council, but maybe like some sort of wellness community input, for like what, Cloverdale wants to see as far as wellness in their community, and getting input that way.
Well, next Wednesday, we are going to have a workshop for gardening. And it sounds like it's going to be lots of people are coming to it. So we're really looking forward to it, because we're going to have the gardener from Yakima. I can't pronounce his name. You connected me up with him.
Uh-huh.
And he said he would be here for it to answer questions on gardening. And it's all about healthy eating, vegetables and fruits. That's where we're going with that day, just to get people involved in gardening, especially the elders, get them out doing something. And it's all container gardening.
Mm-hmm.
Because we are landless, we're doing it in containers.
Mm-hmm.
And we got what you call smart bags for small containers. I don't know if you've heard of them. They're made of cloth. They're cloth planters. And then we did some other things that are going to be really fun. Yeah. And we did some other things. We're going to do some other things that are really fun. So we're looking forward to this. But no, we don't have a diabetes council. And it's probably something we should try to develop. It would be a good idea, because we do have a lot of people with diabetes.
Yeah, kind of, that sounds awesome. And maybe using that garden activity as kind of like a launch point to maybe recruit or identify some interested folks that would be interested in kind of continuing to be on that wellness journey with you guys as travel admin.
Yeah.
Go ahead.
No, go ahead. You go ahead.
And for those, in the clinic, is what Julia talking about, does that seem like relevant or realistic, or, what are your thoughts on that, from your guys' setting?
I don't know. I would really have to forward that question to Vicki, who's not in the office right now, because she's familiar with it more so than I am. So I probably wouldn't have an answer for you for that.
That's okay.
Yeah.
What about Rebecca and Kristen from your guys' kind of clinic standpoint?
Well, I think it's realistic. Getting it implemented on my end might be a little bit hard at first, but I was thinking about how she uses, like they have a meal, and she said she's very consistent with their protocol on doing that. And I know we have a hepatitis C group that meets the first Monday of every month. and they're more than welcome to bring family, friends, but a lot of it's catered just towards our patients, but a lot of other people show up, and every time we offer them a meal. And so the turnout is amazing. You know, we can get upwards of 30 people that are there, and with that comes new referrals for the clinic in itself. So I do have some contacts within just our community that I was thinking that I could possibly do a community meeting, and then we can bring in some kind of meal to entice them to show up. Or I recently met with our local farmery and to talk about possibly us opening up a local farmers market. And so with that contact, I might be able to get some overflow of their vegetables or something that could entice people to come. And I think that would be wonderful. Sorry, I think that's feasible for us to be able to create some kind of once a month community meeting, or, you know, and I think with that I could possibly, you know, get more out of the community. Everybody loves food, so I think that was a good bait to bring them in. So
since we are full staff now, it's kind of easier to be able to get more people on board to help organize these things. So it's probably something we will definitely be looking into, to start an actual community council, instead of just us brainstorming what we think the community will want. But yeah, like, you know, it's just so much easier when you have a full staff. And since we do have an outreach nurse and full CHRs on staff now, and so it's a little easier to get things done when it's more than one person organizing everything. So just a heads up, you got a lot of work ahead of you, Kristen, if it's just you. So, you know, try to get as many people on board as you can to help you. So.
Yeah, thanks for saying that. You know, I mean, not that you have a ton of extra work, but, you know, Kristen, but you know, it's good, and it is easier when you have more people on your team and more input. And one thing that I really love that you said, Julia, is that consistency, even if it is 2 people, you know, like meeting with 2 people and meeting when you say you're going to meet. And, you know, sometimes it can be challenging and frustrating, or, you know, kind of demoralized, like, you know, a pin in your balloon, to feel like, it's not working. But I love that idea of just being there consistently, and for the community. And kind of with you, Kristen, if there's already that, you know, hepatitis group, you know, maybe even not making a whole separate night, but, you know, kind of incorporating or combining, collaborating with the folks that are already putting that on, just to make it like a wellness kind of thing, you know, or a health related evening. I don't know how firm that is, but if you already have people coming and combining funds and resources and time, then that might be an option as well, at least in the beginnings.
Yeah, I could definitely advertise it within that. I know one of our providers runs it, and it's something she's extremely passionate about, and they don't really digress much from the hepatitis point of view. It's strictly about hepatitis C. So, hi Dana. So it would be nice to, you know, I probably could eventually talk her into it, but it's an idea. It's definitely an idea.
Yeah. Well, and we were supposed to mention it in the beginning. We were going to have another presenter today from Sonoma County Indian Health, and she had something come up last minute, so she wasn't able to present today. So she will be at the resource conference, and there's going to be a panel specifically for clinics working in diabetes prevention and doing diabetes prevention programs. And kind of working on team-based care and clinical community linkages. So there will be an opportunity soon to kind of meet together as kind of all clinic type of folks to brainstorm and talk about different things, since I know sometimes working at the community or the tribal level is a little bit different than working in the health clinic. So that will be an option. But does anyone have any kind of final thoughts? I really appreciate everybody's input.
I just had a thought. So for our program and the CDAC, the outreach department does it. So they have access to all of the, the electronic health records. They know who's been diagnosed. So that's kind of how they get the word out to people who have diabetes and might want to be involved in, the diabetes education group. I don't have access to that. So our ACORNS group is separate. And so, but the mailers are still sent out to everybody. And so, if you have access to your electronic health records, and because we have we say around 200 people diagnosed with diabetes right now. And so if you think about it, if we have 20 people show up, that's like 10% of the population, people with diabetes in our community, our Native community. And so are we having an impact? I think so, because that's a good percentage. It's not everybody. But what our outreach department does too is that when we have our diabetes awareness walk, we ask people to come and they acknowledge people who have done all of their diabetes care, their foot checks, their eye checks, their monthly visits, or however often they have to come in. So the outreach department does that. And last year I was amazed because some people I didn't even know they had diabetes, and were really working on reducing their weight and doing all these self-care kinds of things, came and they were recognized, and they have to agree that they know what's going to happen. So it's not like they're putting a business out there, but they say, yeah, I would participate. So when they come and they get like a little certificate and some kind of, I think last year we gave abalone shells, and so something that just recognizes their efforts. So that's kind of how we stay connected. And we know, I'm not in the electronic health record system, but that's how our outreach department gets all the word out to that community. So that might be something. I think the other health clinics probably have access to that. I'm not sure.
Yeah, so using the electronic health records, or your clinic outreach team to recruit and identify people to invite to some of these meetings and stuff, is that what you're saying?
Yeah.
Yeah, and that's an awesome way to do it. That's how we get a hold of our community. Other than flyers and the basic info, we personally call them or mail them, or mail them everything that's going, all the events that are going on. So, but yeah. But thank you, Julia. You did an awesome job. You gave me some ideas for a few of our programs. So.
Oh, you're welcome.
Yeah.
So if I email you, don't be surprised.
Okay, I won't.
Yeah. Do you want to type your email in the chat, Julia,
Sure.
in case people want to reach out to you?
Yeah.
And then as you're doing that, so Julie has a couple just announcements before we sign off.
So my first announcement is in regards to the annual resource meeting. So it's going to start on the 3rd. So you guys had that option where you could drive in, especially Julia, you and Rebecca are coming from a longer distance. So coming in, checking in on the 2nd, we start 8:30, right?
I think it might be 8 or 8:30.
8 or 8:30, but we'll confirm that with you guys before the conference. And so just remember that the sign in and out sheets are really important, because when I finalize the hotel, or if I'm assisting with any sort of travel, that I have to turn in all that paperwork to our finance department. So if you're signed in but you're not signed out, I can't turn those things in. So just really making sure that you're signing in and out for those the sign in and out sheets. Let's see, their change tool is due March 30th. So for those of you who are going to be doing the change tool, March 30th it's due.
And that is kind of a firm deadline. So the surveys will become inactive after that date. So I know a lot of you have expressed interest or maybe completed one of the surveys or a couple of the surveys. So if you do want to finish those and participate in that and then get that $500 reimbursement, the 30th is that cutoff date for that.
Yeah. So also, Geneva has sent out some emails in regards to, at our annual conference, we would like you to either bring a poster about your activities that you're doing, or you could do a PowerPoint, kind of like what Julia did today, that we could put that up and highlight your program, or also possibly a digital story that you could share with everyone that's going to be in attendance. We did send out emails. I've sent out numerous emails. So if you guys can send a logo to me and a picture of your ACORNS CITE team, like sooner the better would be great for me. If you have any questions at all, do call me in regards to confirmation for your hotel. I have you guys all on a master list that I have in-house here, and then I will turn over to the hotel so they will know exactly who's coming and for what days you guys will be there.
And for just as a reminder for the poster and the PowerPoint, so there's going to be some time for pretty much, well, for every grantee to sort of give a little bit of an update and an outline of what they're working on or what they've accomplished. So you will be hearing from everyone. That being said, there's a lot of you, so kind of just trying to think about it as like an elevator speech of what your project is. So just kind of a quick overview, 5-ish minutes is kind of what we're shooting for, because you times that by 25 or 26 people, so to try to keep it within the range and allow everybody a chance to kind of talk. Hopefully that will there'll be more opportunities for you to follow up with folks if they mention things that are interesting to you and you want to talk more about their projects. You'll kind of have a general idea of what everyone's working on, and then you can reach out to those folks that are that you want to kind of go deeper with that. So we can put the PowerPoints up. A couple of slides is probably the max that you'll need. If you do end up doing a poster, I know a lot of you guys did posters last year. So something similar to that. We're looking at maybe trying to highlight what your objectives are that you outlined in the plan, and maybe what some of those activities are that you're working on to meet those objectives. So yeah, so that's just kind of, if you have questions about that, or if you want to get some feedback on what you're preparing, feel free to shoot those my way. We can talk about it and work that out. So. And did we had a guest from Cloverdale, a cameo appearance? Did he want to say hello?
Yes, you did. It's Lawrence Straw, Larry.
Oh, okay.
He's part of our ACORN team. This
Hi, Larry.
is Geneva and Julie.
Nice to meet you.
Nice to meet you. I know your name.
Yeah, right.
They've heard about you.
All right. Yeah, I'm new.
Okay. Do you have any other announcements?
Nope. If you guys have any questions, call us. Remember, we're still here in the office. Bear with us because we are living out of boxes right now. So, but any questions at all about anything, just let us know.
Any other final comments? Okay. We hope you have a great day. There is another webinar a week from tomorrow. It will be recorded. It's with Dr. David DeRose. He has worked in tribal communities for a long time doing health and wellness, and he's got a book and a bunch of materials like the book materials, some like webinars, some different things, some pamphlets that are available for tribal communities. His grant is specifically focused on reducing blood pressure through sort of natural, like healthy lifestyle choices. So most of those are pretty similar to diabetes prevention. So he's got some good information, good resources. So hopefully you can join that. That's next Thursday, the 28th from 2 to 3. If you're not able to make it, it will be recorded, and we'll have his contact information if there's, if you want to reach out to him in that way. Oh, and Julia just mentioned, if anyone is interested, Dr. Michael Yellowbird's work is Decolonization of the Mind, interesting and helpful. And I actually wrote that down as well. I think that's very interesting. Maybe we could even have him do a webinar for all of us. So, okay. Well, thank you so
Thank
much,
you.
you guys. We hope you have a good rest of your week.